Good afternoon, everyone, and welcome to today's 2021 Virtual Behavioral Health Forum. My name is Kevin McCall, and I am the supervisor of the McLean County Triage Center. Today, I will be standing in for Behavioral Health Coordinating Council Supervisor Tricia Malott, who sadly cannot be in attendance with us today. To start, I'd like to talk for a second about the forum itself. The McLean County Behavioral Health Forum is typically a one-day event consisting of multiple breakout sessions, but with the ongoing global pandemic, we have adapted our in-person format, and this is now our second year holding the forum virtually. We're really excited about that, and we're pleased to offer a wide variety of virtual sessions related to behavioral health that will be offered through the beginning of November this year. Please check out our website for a full listing of these sessions, which this year include topics such as the role of stigma and inclusivity, self-care and living well, and a discussion panel featuring community members with lived behavioral health experience. All registration is free, and you can even register the same day. Sessions are held at varying times, but all presentations, including those from last year's forum, are uploaded to the McLean County Behavioral Health YouTube page. And I'll provide links for both our website and that YouTube page in the chat located on your sidebar. I will also mention this again at the end of today's presentation. The idea of free community education, the highlighting of available community resources, and the sharing of ideas through the Behavioral Health Forum originated out of the Mental Health Action Plan, which was adopted by the 2015 McLean County Board. This plan originated out of more than 100 community members that identified needs and best practices related to behavioral health specific to McLean County. In these uncertain and difficult times, we believe that it is more important than ever to help provide education, resources, encouragement, or even simply recognition of life's challenges. During today's presentation, there will be time at the end for questions. We ask that if you choose to ask a question while the presentation is ongoing, that you provide enough context so that question can be asked appropriately at the end. So if you were to say something like, could you please tell me about that? I'm going to need you to specify what that is because the question won't be asked until the end of the presentation. I will double today as our question moderator, so I'll see those as they come in, and I'll also be helping to facilitate today's panel discussion. So with that being said, I'd like to introduce everyone that is in attendance today. Those on your screen are not the only ones in attendance. We've had a bit of a technology issue, and as you start to do enough of these things, they just can't simply be avoided. So a couple of people won't appear on your screen, but you will hear from them today. So we have Derek Kimler from Central Illinois Friends, Michelle Cook from the Joy Care Center and the Jobs Partnership, Dave Bentlin from the Prairie Pride Coalition. We have Gaynette Hoskins and Susan O'Neill with Prairie State Legal Services who are on the telephone with us today. We have Toy Beasley, who is representing the TASC and the New Reentry Council. And then we also have on the phone with us today, Linda Foster from the Bloomington Normal NAACP. And so really the goal of today is that we want our attendees to be able to better understand the impact on mental health in various marginalized communities, as well as hear from respected voices in those communities about available resources and efforts to help individuals within those marginalized communities. So I'd like to turn it over to Derek Himmler, who is first going to talk about Central Illinois Friends and new clinic services. Thank you very much for being in attendance with us today, Derek.
Absolutely. Thank you for having me, and thanks to everybody for joining. It's pretty exciting that we just announced in June, and we had our grand opening in August, the opening of our second location, Central Illinois Friends' second location, which is at Normal, Illinois. It's actually on Franklin Avenue at the Community Healthcare Clinic, and it's directly down the street from Carle Hospital, in between Carle Hospital and ISU, to kind of put you to a location. For those of you who don't know, Central Illinois Friends been around since 1990, and we started as a hospice center for people that were dying of AIDS-related complications. Since then, we've adapted and changed with the times to help people live a long and healthy life living with HIV. And because of science and because of the modern technology and medications, we're able to help people live a long and healthy life with HIV now. And so we get to a point where we can get to 0 new HIV diagnoses in our community. But that takes prevention, and that takes education and ending stigma and access to care. And so when we started down this route 5 years ago, what we found is that there are still a lot of barriers to care for many different populations. People of color, specifically Black women and Hispanic individuals. We find that non-English speaking individuals have a hard time accessing care, and the LGBTQ plus community. Rural healthcare as well is coupled into that. So what has happened is Central My Friends kind of became this catch-all of all the people falling through the cracks of the medical society. And with that, we really took a good hard look at our mission, and we thought long and hard about, how are we going to get to 0 new HIV diagnoses? How are we going to lower STI rates? How are we going to be able to provide better access to care? And it's by creating a completely free sexual health clinic. And that may make a big question mark in your head of why does sexual health have to do with access to care? But to be honest with you, it's one of the largest gaps when it comes to accessing hospitals and healthcare as a whole is sexual health. And so we start there and then find out our need. That's where this LGBTQ plus clinic comes in. So through our process, we found a lot of different avenues of where our area has lacked in healthcare in general. But what we realized is there were 0 services for trans individuals and 0 services for LGBTQ primary care in our community. And we found that people were driving all the way to Chicago, or trying to grab a plane to Chicago or train to Chicago, or going down to St. Louis to try to get LGBTQ healthcare services, when we have the ability to do it right there in Bloomington Normal. During COVID, we even had populations that were struggling trying to get to Peoria just to access our sexual health. And so working with Dave Bentlin at Prairie Pride Coalition, as well as many other people in Bloomington Normal, like Lynn Meyer at Planned Parenthood, and Trish over at ISU as well, and a few others, we were able to, and Mike at the Community Healthcare Clinic, we were able to open up a location so that transportation wasn't a barrier anymore, so that Bloomington Normal too could also access these services. So I guess the big question is, how does this affect all individuals of the community, right? As a whole, how does this affect the whole entire community? Well, we're a completely free healthcare clinic, right? Everybody that comes in will get free services, free vaccinations, free STI testing, free STI treatment. We're going to find an avenue to care that works for you, right? So that helps every single person that comes to our doors. Now, with that being said, we go the extra mile for those who have those barriers in the healthcare field. That's what we call health navigation services, or what many people would consider equity in a healthcare center. So we really focus on meeting people where they're at and providing good quality equity to get people the extra step that they need to access care, to make sure that we hold their hand through the process so no one is left out. And so what happens is we see that we're able to provide that really from intake to prescription, no matter what box you check on the intake form, that you're treated fairly throughout the entire process, and that you can afford whatever it is you need in the healthcare field. Which that kind of embeds the relevance of social justice and equities and social determinants of health that we are addressing. Because a lot of those boxes we check in the healthcare field end up getting in the way of our actual health. And I say that to say that, yes, I've been on many of these calls, and it shocks a lot of people that work in the healthcare field just how many racist policies there are, or sexist policies, or homophobic policies. And it may not be necessarily meant to be that way, but the fact of the matter is that someone from a population did not make a decision, and without thinking of those populations that we need to help, it's inevitably been a deterrent for them to access that help. And so these old policies that are from the 50s, 60s, 70s, 80s that we have not tried to address, that we've just chalked up as, well, it's always been this way, we've always done it this way, that's what's getting in the way of organic and holistic healthcare. So we're trying to help navigate and find a way around that. And lastly, the fourth question there, how do people get involved if they're interested? Please check out our website. You can email our outreach email, which is on our website. We have volunteer options. We do a lot of community-based events. We provide, if you are with a school or a clinic and you want our services at a certain fair or a day, we actually go mobile and we bring our testing and our vaccinations to you. And we mold to what works for you. We talk about meeting people where we're at. Well, we meet the agencies where they're at as well. It's all about doing what we can to work together to meet people where they're at and to obliterate those policies that are getting in the way of them accessing the care that they need. That was quick.
No, that was great, Derek. Thank you. Thank you very much. You absolutely answered a lot of the objectives that we set out to answer here. I can really hear the conviction in your voice, and I always love that when I hear that passion. So you talked a lot about obviously sexual health and that being, physical health. How does CI Friends and the clinic improve the mental health for the LGBTQ community? So that more mental health perspective. Obviously, this is a behavioral health forum.
Yeah. And so I'm actually glad you brought that up. So it's funny, and Dave Bentlin and I were just spending Saturday together because I don't know if you know, but October is LGBTQ History Month. And we've opened up a wall at Bradley University that's a traveling exhibit in Peoria, Illinois. And it's really good stuff. If you find yourself in Peoria for the next 2 weeks, go check it out. It's completely free to go check out. LGBTQ history. But during this seminar, I made a comment and I said, LGBTQ individuals are more than their parts and how they use them. And I think when we say gay and lesbian and transgender as adults, we over-sexualize LGBTQ individuals. But we have to also acknowledge that when we're talking about healthcare, that is the #1 thing we leave out. So when we're talking about social justice, we over-sexualize LGBTQ individuals, but when we're talking about healthcare, we ignore it. And so when we're talking about mental health and physical health and sexual health or healthcare as a whole, when it comes to LGBTQ individuals, we have to make this more simple. We have to stop getting tied up into the nuances of who people are. And this really does help the mental health aspects by simply asking pronouns, by asking what their name is, it's their name, preferred name, it's their name. Do you need a legal name in certain situations? Yes. And everyone will understand when you need that legal name. But that person goes by a different name forever. We in the healthcare field have always done a really good job of calling Roberts Bob and calling Williams Bill. And if we can do that, then why can't we do that with our transgender patients? When we don't know pronouns of our neighbors, we say they. In the English language, we've always used they, them, and theirs for the preferred pronouns of those that we don't know. Oh, it's our neighbors. They're over there. That package is my neighbors. If you don't know what their pronouns are, you've always used they, them, theirs. It's not as hard. You're gonna make mistakes, and that's fine, but you have to acknowledge it and you have to move on. When we start to overanalyze and we start to get in our headspace about things that doesn't pertain to us or matter to us, that is when we start to lose connection with our patients. So I start with that to say, That is 90% of it. And I'm not joking when I say that 90% of taking care of transgender individuals in the healthcare field is literally acknowledging their presence and what name they want to be called, what their name is, what their pronouns are, and that's it. Now, the next step is, what are your parts? And then how can I help you from there? Because if your pronouns are she, her, hers, and let's say, and I'm specifically talking about mental health here, that tells me nothing about what your identity is, right? You said she, her, hers, but your identity, your expression, your sex, and your sexual orientation are all different things, and they don't correlate. So the assumptions is where we start to lose patience. So I'm going to go over that again. This is your identity, right? So my identity says that I'm a man, okay? And then this is my sexual orientation. My sexual orientation is who I love. So I'm a man, but I'm in love with other men, okay? I love other men. And then your expression is how you express yourself. Say I was wearing a pink dress. Just because I'm wearing a pink dress doesn't mean that I'm not a man and that I love other men. And then there's the actual sex and anatomy. And just because I say I'm a man and that I love other men and then I have a pink dress on doesn't tell you any parts that I have, right? You wouldn't know that unless you asked me or we had to do a full exam. And so by just simply acknowledging those things and not making assumptions and getting down to meeting people where they're at, you're going to eliminate the majority of your problems when trying to connect with an LGBTQ individual. Because before you even open your mouth sometimes, you've already lost the respect or the connection with that individual because they feel like they can't trust you. The final thing I'm going to say, if I may, the other thing about the LGBTQ plus community is they've been poked, prodded, and used it as an example in the medical field for so long. Our older generation feels this to a point where our younger generation doesn't as much. But intersex individuals have been treated as tests for a long time. For instance, there's a 50-year-old who's the president of the Intersex Society of the United States, and she is a woman who identifies as a woman. She was born with a vagina. Her body responds to estrogen, but she's intersex because she has testicles where her ovaries would be. Instead of telling her that, the doctors said that she had ovarian cancer at age 14 and that they were going to have to operate on her and that she would never have babies for the rest of her life. And she didn't find out that she was intersex until she was in her 40s. Now that brought up back all this trauma that was happened in the past from what the doctors actually did to her that they wouldn't have normally done to a 14-year-old girl that had ovarian cancer. So this stuff is very much real, and that is just one example of many when it comes to LGBTQ plus individuals in the healthcare field.
Yeah, you made some really powerful points there. I think there are just so much misinformation and so many misconceptions out there. It's good whenever you have an opportunity to clear some of that up and educate on that. Thank you very much, Derek. One last question for you real quickly. What is a tangible takeaway that you can offer the audience to preserve self-care and resilience?
Mm-hmm. Well, that's a good question. I'm actually trying to work on self-care myself as my eyes over here twitching because of lack of sleep. You can only do what you can do, right? And I think being patient with yourself. I know this is just because I'm over here talking about the LGBTQ plus community. So I'm going to say this: you're going to make mistakes. If you're not LGBTQ plus, if you are LGBTQ plus, we all make mistakes. We all say the wrong thing. We all make missteps when dealing with patients at times. And we have to acknowledge, so long that you have the right intent and you remember why you're there, you're not in the wrong. And you have to always accept, like, yes, this is where I messed up, and I'm willing to do better because I'm here for the right reasons, not the wrong reasons. And that's what you always have to go forward with that. So long that you have what's best for the patient and the client and the mission overall, then you will always be able to get past those mistakes. And I want to add to that, one more thing to add to that is, if you're having a hard time with a patient, an LGBTQ plus individual or not, just always take a step back and simplify it, because I guarantee you, you're making it more complex than it has to be. For instance, we've had a patient in here just earlier today, and I'm not going to give you a lot of the details, but when I had to tell the counselor, just take a step back and imagine this as a heterosexual relationship. What would you do? And it cleared up the issue. And it was just having to step aside and realize that, oh, just because this is a woman and a woman doesn't make it any different than if this was a woman or a man. And so it's just taking that step back and trying to simplify what our minds are telling us is complex when it really isn't.
Awesome. Thank you so much, Derek. At this time, I'd like to turn it over to Mr. Dave Bentlin with the Prairie Pride Coalition.
Thank you very much. Derek is always a hard act to follow. His energy is infectious, and I appreciate always hearing from him and getting new ideas and new perspectives from him. I'm here today primarily to represent the Prairie Pride Coalition. I'm also a staff member at Illinois State University, and during the course of this discussion, I might touch upon a couple of things that the university is doing to address the mental health disparities among our LGBTQI plus students on campus. But my primary comments are going to be geared toward Prairie Pride Coalition, which is our local LGBTQIA plus community organization in Bloomington-Normal and McLean County. We were founded in the fall of 1995 with a very specific mission. Back in that day, in 1995, there were no civil rights protections for members of the LGBTQ plus community in Bloomington-Normal or the state of Illinois. And what that meant was that we could be fired from jobs, we could be denied service in restaurants, we could be denied housing from landlords. There were basically no civil rights protections for our community. And at that time, our organization was among other organizations, local organizations in the state, that were seeking to update their city's human rights ordinances to include sexual orientation and gender identity protections in those areas. And that is how our organization began, really seeking out remedies for people who were experiencing discrimination and trying to help enact laws locally that would protect our members of our community. Over time, we did achieve those efforts to expand civil rights protections for gay and lesbian, bisexual, and transgender people. And later on, the state of Illinois also followed suit. And so now there's a state human rights act that includes protections for members of the LGBTQIA plus communities. Over the course of time, we've been in existence for 26 years now. We have broadened our initiatives to include a number of other things. And I would say that our overarching goal as an organization, our mission, what I might call our mission, is to make Bloomington-Normal and McLean County a more welcoming, safe, and inclusive place for members of the LGBTQI plus communities. Sorry, I kind of fumbled over that. I can kind of give you my own personal story. I came to Bloomington-Normal in the fall of 1980 as a student at ISU, and I had no intention of staying. At that time, it was very common for members of the LGBTQI plus community to migrate to larger cities where there was more of an established gay community. And for one reason or another, I completed my studies at ISU. I got a job here at the university, and I found myself, though, running into a lot of other people who had decided that, for one reason or another, they were establishing their home in Bloomington Normal in McLean County. And we began to realize that there was a growing community of us in Bloomington Normal and McLean County. And that's when we decided that, this is our home too. We have a right to live in an environment in a city that is safe for us, where we can enjoy civil rights protections, where we can feel a part of the community, where we can walk down the streets, in some cases holding hands with our significant others without fearing recrimination or violence. So over time, the Prairie Pride Coalition expanded its initiatives to make Bloomington Normal a more welcoming place. And that is what we continue to do to this day. Much of our work is done in coalition with other organizations like Central Illinois Friends. And because the bottom line is, we're an all-volunteer organization. We've been in existence for 26 years, and we've been able to do so with no paid staff, no physical office space. We basically, there's a small but mighty group of us that keep together. We have a 10-member board that is very active, and we're able to accomplish quite a bit, despite the fact that we don't have the paid staff or the physical space. But I think that what we do, we don't have programs that I would call specifically geared toward mental health. But I think a lot of what we try to do in the community contributes to the better mental health of our LGBTQIA+ citizens. We offer a variety of events, educational sessions, services to the community, and it's our hope that all of those offerings help us to make this a more welcoming place. As Derek said, when it comes to healthcare, there have been so many cases where people have had to leave Bloomington Normal to find the health care that they need. We try to remedy some of that by publishing a business and resource directory that is geared toward our community. And in that directory are listings of counselors, of healthcare professionals in the community that have expertise in the issues that are important to us. So we try to provide the resources for people in our community so that they can find the help that they need, that they can find the support that they need. And again, that kind of leads us toward making this community a better place for our LGBTQIA+ citizens. So that's what we as an organization try to do. I think it's very relevant to pair social justice issues with mental health issues. Just passing legislation, helping pass legislation that secures our civil rights can only help the mental health of our citizenry. I mean, you can imagine, actually, I'm going to even go back a little bit further. There's a special that's airing on PBS this month. This is LGBTQ History Month. And some of you may remember back in before the early 70s, sexual orientation and gender identity were termed as mental illnesses. And up until, I think it was 1972 or 1973. And in 1973, the American Psychiatric Association came out and declared that those should not be considered mental illnesses, that they're conditions that, like all other people, from time to time, people need counseling, need assistance with issues that surround our sexual orientation and gender identity, but that they should not be termed mental illnesses. So I think that there was a social justice effort to overturn that myth that we are mentally ill. And I think that a lot of our efforts legislatively to bring about better laws, to bring about better court decisions that recognize our community as equitable with other parts of the greater society. I think that those are all very much intertwined with social justice efforts and with the mental health of our community as well. So I'm looking through my questions here to see, I'm sort of jumping all over. I'm afraid I'm not as coordinated as Derek was about this.
Oh, that's okay.
I will say that if people want to get involved with our organization, there are opportunities. I think the best thing to do is to go to our Facebook page and send us a message via our Facebook page. We are getting together a number of new initiatives. We're putting together some local social and support groups for specific sectors of our community. So we're trying to offer those sorts of services as well. And as I said, we're all volunteer. So we rely on volunteers to help make those things happen. So I would encourage folks, if they're interested in specific ideas, that they contact us through our Facebook page.
Terrific. Thank you very much, Dave. So I had two supplemental questions for here, but it seems like you kind of touched on each of those at least a little bit. The second one, maybe not as much. So let me ask, in relation to ISU, what activities and events does ISU host to promote mental health for LGBTQIA+ students on campus?
I don't know if there's so much events, but I will say that there are programs and initiatives that that we have instituted at Illinois State University that I think that help lend to the better well-being of our LGBTQIA+ students who have the good fortune to come to our campus to study. We do have a very strong student counseling services unit, and they offer a variety of counseling services and support groups for students who come to our campus. And I will say that I think what is a particular feather in their cap is that when an LGBTQIA+ student goes to student counseling services here, they see a very diverse staff in that unit, and chances are they're bound to see someone like them when they see a counselor or they go through an intake process. So our student counseling services staff has the expertise to address the issues, and there are many issues that young adults face when they go to college for the first time, and they're coming out, they're experiencing all sorts of different situations than they did before. So we have a student counseling services in place that really address a lot of the issues that they're facing. We also have a student organization and an employee organization. You know, a lot of times people talk about the services that are offered here at the university for LGBTQIA+ students, and we have a very strong student organization that puts on a variety of events that help to raise awareness, spread education about issues that are important to our campus community. But we also have an employee affinity group called the Queer Coalition, and we have a lot of staff members on campus who are members of the LGBTQIA+ community. And it's become apparent that, especially during these times of pandemic, that we need these sort of networks to keep in touch and to commiserate and to plan to help spread awareness and education in our own way on campus. So we do have those organizations as well. One area that we've had a fund for quite some time, it's an LGBTQIA student support fund. This was established, I believe, close to 15 years ago. And this fund was established for students who come to Illinois State University who may be experiencing financial distress because of situations where their family has deserted them. Some cases where they've come out to their family members and their family members said, I cannot support you financially if this is your choice, which we all know it's not a choice. But at the same time, we've run into students who are in those situations, and they are in fear of having to drop out of school because they no longer have the financial or the emotional support of their family members. So that support fund was established about 15 years ago, and it has made a huge difference in helping our students who are in those situations to stay in school, to finish their degree, and to feel a sense of support from the Illinois State University community during some very stressful times. Something that has happened recently that some of you may be aware of, may have been in the news. We have our student housing services has instituted a rainbow lifestyle floor on campus in one of our residence halls, where people, students from the LGBTQIA+ community can take out housing contracts and live among other folks like them. or among advocates who advocate on their behalf. And again, this is another way of providing an environment that is nurturing, that is welcoming, that they can network with people like themselves. It's all part of the extracurricular education that is offered through Illinois State University. That education outside of the classroom that's every bit as important to the well-being of the student as what takes place in the classroom. And then I guess one of the other things that I would address, and I know Derek mentioned this too during his part of the presentation, as a university, we have worked hard to update our information systems to better identify the students who attend our university. We have a number of transgender students who attend our university, and over the years we heard stories about them being dead named in the classroom by faculty members who are teaching their classes. And this is when a transgender person is in the process of becoming someone else, but the faculty member continues to refer to them as their original name. And we all know that that does not make for a healthy mental climate for a person who's going through a transformation like that. So we have, as a university, have built it into our information system so that when that information is shared with the faculty members who have those students in their classes, they can address them as their proper identity. They're supplied with the pronouns that the students prefer. So it's all a part of honoring the gender identity of the students that are in those classes. So that was a process that took a while. It was, some of these information systems are really hard to adjust to make them representative of these new bits of information that need to be shared with faculty members. But it's all part of an effort to make our university a more welcoming, equitable, inclusive place for all the students that come to our campus.
Terrific. Thank you so much, Dave. I really love hearing about all of the stuff that ISU is doing, not just as an alumni myself, but as a lifelong community member. It's always great to know that there are people out there looking at the interests of all of our ISU students out there. I also appreciate the connection you made between social justice issues and mental health in general. I think that was a really strong point to make and kind of a bit of the theme of maybe what we're talking about today. So next, I would like to introduce Mr. Toy Beasley, who is talking about, or is representing, TASC and the new Reentry Council.
Hello, my name is Toy Beasley. I'm with an agency called TASC, Treatment Alternatives for Safer Communities. I'm the Reentry Support Coordinator, and I'm also part of the Ross Council. I'm also part of the Reentry Council that just started back in May of this year. And also, too, I help facilitate a support group called Winter Circle, and I will share those. But today, I just want to focus on the Winter Circle and the Reentry Council. First of all, how the Reentry Circle started was a group of us, about 5 of us here in the McLean County community, decided that individuals that's coming home from prison, to back up a little bit, I am a person also with lived experience that has been just as impacted. I'm a person that spent time in the Illinois Department of Corrections from 1991 to 1999. And that has been my passion is to when I paroled February 1999 to come out in the community and help the individuals that have been just as impacted so they have a better life that was coming behind me. So how the McLean County Reentry Council started, like I said, it was a group of us that got together and we saw there's a need that in McLean County because reentry wasn't talked about. A lot of our when we got together, a lot of individuals didn't understand how we went about coordinating what we did in the community. So when we got together, our strategy was that how can we get the word out to our social service agencies, to our community, to let them know that these people that are returning home from prison are not bad people. There was people that got caught up, made mistakes in the past, and they just needed another opportunity. So as we began to coordinate this, we began to get the community involved by word of mouth, emails, and to help the community know what we're doing. One of the main reasons why we're doing this too is so our individuals that's coming home from prison, that they have some type of support system. A lot of our individuals that come home from prison, that they lack resources, anywhere from employment, housing, just regular civil engagement. You know, a lot of people come home, they just felt like they get thrown around. So we basically wanted to be a voice for the voiceless. And so what we do on a monthly basis is that we get together as a community. Right now, it's about 25 of us that consist of people that work in the community, people that's involved in the social service, the community, and we just talk about things monthly on how we can better help the community understand what we're trying to achieve here. So that's basically what the reentry council is. We meet on a monthly, like I said, we meet on a monthly basis. We usually meet every third Friday from 1 to 2:30 to get involved in that. Second, I want to address is the Winter Circle. A Winter Circle is a peer support group that is similar to an AA or NA meeting. A lot of our people that come out of prison, they're not comfortable going to an AA or NA meeting. So the Winter Circle support group is provide that peer support group for formerly incarcerated. A lot of our people that come out of prison, they dealing with shame, they're dealing with guilt. They think people, they don't understand them, like myself. So they need a type of support group. That's why I call it a different type of support group. Winter Circle was started in February 1999 in Pennsylvania. There was a group of wardens that got together out of Pennsylvania. They decided that, you know, why are these people continue to come back to prison? And they realized that AA wasn't working, NA wasn't working, so they needed to develop a program that can make that certain population to be able to open up. A lot of our people are in and out of prison because they're dealing with untreated trauma. They have nowhere to share their pain, their expression. So what they do is they get out of prison, they have no type of support group, then they recidivate, they come back to prison. So Winter Circle provides that self-help group for those individuals to come and talk about some of that untreated trauma. A lot of our people that come out of the criminal justice system, they're not locked up because of the crime they committed. A lot of them are locked up because of the untreated trauma. For instance, give an example, a lot of people that's coming out of prison, things happen to them as a child. They begin to carry that pain that they went through as a child into their adulthood. And so when if that pain is in their childhood and it's carried to their adulthood without dealing with that, then that's when they become an issue. So we try to get them to address that thing there. Also, with the Winter Circle, we try to get them to be pro-social. We try to get them to practice those social skills. So if individuals begin to get out and they begin to practice those social skills and they begin to trust the community, then they can begin to see light at the end of the tunnel. So that's basically what the Winter Circle is. So question 2, how does it affect the initiative to have potential to affect the individual? We got to continue to have conversation. If we, as a community in McLean County, if we can't be open, receptive to our formerly incarcerated, how can they grow? And we can't continue to punish them for the crime they committed 20 years ago, 10 years ago, 5 years ago. So if the community is not receptive to accept this population, then that's where those individuals begin to turn back to what they know, because they feel like if I can't be accepted in my community, then I'm gonna turn back to what I know. And usually those individuals turn back to drugs, alcohol, crime, to help deal with not being accepted. And so when you begin to accept them for who they are and not what they've done in the past, then you have a better receiving community. You have a better receiving individuals that get out of prison that 9 times out of 10, the 10 want to be successful in the community. Question 3, I'm not going to elaborate on this now. It said better relevance to social justice. I would say we got to continue to have those conversations. And I think that it even when it involves the mental health, Dave and Derek hit on a lot. If we don't continue to have those conversations when it comes to social justice, even when our individuals are getting incarcerated and coming back out in the community. We just recently did a fully free campaign here in McLean County. And what that fully free campaign is to educate the community that we can't continue to punish individuals for crimes they committed 10, 20 years ago. So our whole objective is that we want to bar our local legislations to let them know that We need to change policies. If we don't change those policies to help our individuals make those changes in the community, then where's going to come in at? You know, for instance, I give a couple of examples here. If a person's has been out of the system for 20 years and they have a college degree, they met the criteria, why can't they work in State Farm as a claim rep? Why can't they work at Illinois State University, the payroll department? Why do we continue to punish people for the crime they committed years ago? Why can't that happen? So that's what the Fully campaign is to help push policies, help change policies so the individuals like myself and other individuals have an opportunity to be successful in the community. And I truly believe once we begin to make those changes in our community, that's when the recidivism begin to drop, I believe. So how can you get involved? How can you get involved? You can get involved with the Reentry Council by emailing me at tbeasley@task.org. Like I said, we meet every third Friday of the month from 1 to 2:30. And it's just the community and community agents coming in, talking about the changes that we need to make here in our community. Also, too, is if you want to get involved with the Winter Circle, right now we don't have any Winter Circles in the community. Before the pandemic, we had Winter Circles here in Bloomington. We have one in Decatur, Champaign, several up in the Chicago area, but right now we're virtually. So we have a Facebook page called Winter Circle Peers Facing Life Struggles. You're welcome to join that Facebook page. That Facebook page talks about our Winter Circle Zoom that we have every Sunday. We have a Winter Circle Zoom every Sunday from 7 to 8. It's facilitated by a person that has been just as impacted. And some of the same things I talk about, we have those conversations with that. If we begin to get our people that are formerly incarcerated begin to open up to talk about some of the life struggles, that's when a big change comes in that. Until then, individuals going to continue to suffer and not have that lack of support. They're looking for support. If we can support them on the things that they're doing in the community, then that's when you see the success set. So that being said, like I said, if you want to get involved, email me at tbeasley@task.org or go to our Facebook page at Winter Circle Peers Facing Life Struggles.
Awesome. Thank you very much, Toy, for being with us today. I want to let everyone know that I'll also, at the end of this presentation, go ahead and drop my contact information in the sidebar. That way, if you have questions for any of today's speakers, because I know there's a lot of information being given out, you can get in touch with me, and then I will then get in touch with them to answer whatever remaining questions you may have at the end of today's presentation. So I had a couple of supplemental questions for Toy, but he already went and answered them. So thank you so much for giving such a comprehensive answer to the outline that we kind of gave you. It's really great to hear about those new initiatives. Next up, I have Michelle Cook from the Joy Care Center and the Jobs Partnership. Welcome, Michelle.
Thank you. I've listened intently to everything everyone said. There's, I'm going to tell you about what we do and how we do it, but let me tell you one thing. There's one simple answer to all of these things that we are talking about today. Mental health, spiritual health, physical health, all those healths. If we look at each other with love, understanding, acceptance, and respect, categorize anybody. I don't want no special area here in town for people that look like me to live. I don't want no special label on me that I have to associate with folks that look like me, We have to be teaching our people, our youth, our adults, to love everybody. My God tells me to serve. He didn't tell me that I can only serve folks that look like me or talk like me or that my age. I'm 80 years old. What I look like with a string of 80-year-olds hanging around me. The thing is that we have to look at everyone with love. Look at them as we are. I'm here to love and learn, okay? And everything that we do affects individuals' mental health, whether we like it or not. It does. So that's why the Joy Care Center Jobs Partnership is a unique program here in the Bloom Normal area. There are jobs partnership programs throughout the United States, and I'm told there's even some overseas, but none of them are like ours because we are based on love. We were founded in 1993, got our 501c3 in 2000, and we were founded to help returning citizens from prison. Well, I became involved in 2010, and the agency morphed into anyone unemployed, underemployed, or hard to employ. And hard to employ is usually because they're coming out of prison, or they've had addiction problems or mental health issues or whatever that makes them hard to employ. So, you know, our whole program is based on love, acceptance, learning, treating people with dignity, no matter who they are, no matter what they look like. You know, I tell me he created us in his image and likeness. So that means God's black, God's gay, God's made, God's transgender, God's all these things. He created each and every one of us. And if we look at each other, if I look at you and see you as my brother or sister or child, it's harder for me to treat you unfairly. That's why I have proud earned the name Mama. I'm Mama. I don't care any of my children you meet, and over 2,300 of them, any of them you meet, say Mama, Mama Michelle. And they know that I'm gonna love their drawers of them, but I'm gonna give if they don't act right. The Joy Care Center Jobs Partnership Program has zero tolerance to drugs, alcohol, and foolishness. Foolishness is treating people ugly, is acting ugly, and is acting at the bar that society holds us to. Have you ever thought about this? We live in a community here in Bloom. There's a million churches everywhere, okay? All these good Christian folks. And I'm a Christ follower. But let me tell you something. If we all did what we're supposed to be doing, following what God's word says, we'd be loving each other. We'd be nurturing each other. We'd be helping each other. There would be homelessness. There would be no joblessness. There would be none of that because we'd be reaching out and helping each other. And that's what our program does. We reach out and help each other. Doesn't what you look like, who you love. You know, you don't know my background. You don't know what I'm doing at home. I might be screwing chickens in the bathtub. You don't know that. You know, what I am called to do is to serve. And if each one of us see ourselves as servants, we are going to then accept, love, nurture, empower each and every individual, no matter what sexual preference orientation is, no matter what their mental health status is, no matter what their color is, no matter if they've been incarcerated or addicted or whatever. And that's what we do every day. We provide housing, we provide jobs, we've got 70 employers here in the Bloom Normal area that hire our people, knowing that our people have scarred past, and usually it's addictions or incarceration. And we have transportation, we have classes, we have groups, and if you want to get involved with us, you come every Tuesday night at 6 o'clock, 6 to 8 is our class, our jobs partnership and celebrate recovery. And every Thursday night, 6 to 8 is our group, which is off the chain, you know, and it's where we deal with all the issues people are going through. And we provide guidance, and we provide love and nurture and support for any issue you're going through. We're there for you. And they know that every one of my children have my phone number, and it's right here. Ringing some of the side don't get back to you. It rings in my pocket, and they know that if I don't answer, I'm busy talking to another child or threatening somebody else or whatever. We have to provide that level of support for mental health, because if you're secure, first of all, secure in your own skin, we come alongside you and help you. We love you and help you to learn to love yourself in your skin, not according to what the world says you have to be, or the church says you have to be, or society says you have to be. What God says you need to be. God holds you to this bar up here. Society holds you this bar down here. We hold you up here in high esteem. And that's what we've got to do to help folks with their mental health issues. We've got to deal with every issue that's going on in that person's life. So we provide jobs, housing, transportation, clothing, food, counseling, groups, and we don't refer people. We call you, like if I've got somebody that I need help with, I might call you, one of you, and give you a name, say what we need, but I'm not going to just tell that person, go see Toy or go see Dave or go see whoever. I'm going to take them there, okay? So they feel that support 24/7, 365. People come home to us. We meet them at the bus, or if family brings them from prison, we meet them. And when we meet there, we hand them a key to their own apartment. When we take them to their own apartment, it's got food in the fridge, food in the freezer, dishes, it's got toiletries, it's got linens, they've got a bed to sleep in, they've got all kinds of things, creature comforts there that you have in your house. And then within 2 days, they get to shop at Recycling Furniture for Families and shop and pick out the other things that they want. We get them clothes, we get them everything they need. And then for the first 60 days, we pay every bit of their expenses, fees, transportation, everything, pay for the first 60 days. Because if they're not stressed out and worried about their finances and about what are they going to do and how are they going to work, they tend to spend more easily, okay? And the other reason is, at the end of 60 days, we want them to be prepared to then become financially responsible for their own bills, but they've got all this 60 days to get hired, save up money, and learn how to manage their money so that in 90 days they can then start to do this on their own with our guidance, but on their own. They become responsible. Things are their name and they have to then take responsibility for things. And then we continue to keep them in the class and in the groups so that they have that connection all the time. We assign them a mentor and an accountability partner that are always there for them to help them through the hurdles. I'm love them to death, but I haven't been locked up one night. So I can't relate to that part of the journey, but I've got plenty other children that can do that and tell them what to look for, what the triggers are when they're going down the wrong path, all that kind of thing, and we have to stand firm in our commitment to our children. We should be having these things. The Zoom call, I don't see the mayor, I don't see the city manager, I don't see the chief of police, I don't see none folks on the council here. That's what we have to do every time, because let me tell you, nothing changes until the laws change and make them do it. Okay, that's how we get the foot in the door with legislation. With our program, I was in the mayor's office so much he calls me mama. He calls me. And the city manager, chief of police, the financial officer, letting them know till I got them all to work with us and support us. Okay, not necessarily financially, but physically, emotionally, whatever. So they know if they open the door to their office, they see this here head wrap, I don't have to give up something. I'm coming to get for my children. And that's what we need to do as a council here to get things done for our people. And I'm going to tell you what, it makes a huge difference to all of our children when they know you're fighting that fight for them like that. It really does. You know, they say, Mama, just tell Mama she's gonna get it done. She's gonna make it happen. And if it can't happen, I've done everything I can to make it happen. And we're gonna try work through it in a different way. So that's how, you know, we're good mental health, good physical health, good family health, good, all those kind of things. It's all rolled up into one. It's not a separate thing. Nothing is separate. It's all connected. And let me tell you something. Who's from Normal? I know you from SU. You're from Normal. I live in Normal. Love Normal. But I'm gonna tell you that slogan, not in my town, not in our town. That's what they, not in our town. We're gonna have balance. Are we gonna help you with any of these things? Are we gonna do anything that might lower our appearance of our society? And we work twice as hard at Normal as we do with Bloomington, with getting anything for our children. So we need to, these blank screens here, you need to have mayors, chief of police, city managers, all them folks need to see their faces on this so that they learn about this at the same time we're talking and networking. They become part of the networking so that they've got a piece to play. They the ones that change the legislation, okay? And they need to see that, and they need to know that we'll vote their kind out of office if they don't do and help everybody, not just the rich people or folks that vote, but everybody. So that's basically who we are, what we are. And I don't know if I've answered all the questions.
Thank you so much, Michelle. I have just two quick questions of follow-up for you. So number one, and I'll just do this in two parts. You said that you guys don't do much of a referral process when you're handing someone off. You were describing more of a warm handoff and making sure you're there during that process. As far as the Joy Care Center or Jobs Partnership itself, what is your guys' referral process? And then additionally, do you support rural communities?
Okay, our referral process is if you have somebody that needs our services, give them my phone number. That's what you gotta do. Tell me. I'm 80 years old. I don't do that Facebook, whatever, none of that thumb. I don't do none of that. Don't email me. Don't do none of that. Pick up the phone and call me or come knock on my, that's the referral process, okay? Now, rural communities, we serve Bloomington Normal, but we spread out, it's Clean County, really, that we serve. If somebody comes to us that lives in some Hudson or something like that, of course, they're going to be provide services. But we're an all volunteer agency. We've been in existence all this long, and we've helped over 2,300 people, and we've only lost 21 of them back to the Department of Corrections. So it does work, okay? So we'll take anybody that's hurt or needs anything, and all you got to do is call 309-226-1715. You're in the mix. If you see anybody or need anybody that needs help, give them that number. Have them, and we hook up with them and get started with the process. Did that answer your question, Sonny?
Absolutely, and I'll make sure to get that phone number from you as well later on, so that way I can provide it when people inevitably reach out to ask me about how to get in contact with you again. because I'm sure they will after that terrific speech. So thank you very much for being with us, Michelle, today. I absolutely appreciate it. Next up, we have Linda Foster with the Bloomington Normal NAACP, and I apologize for our remaining speakers. We have about 18 minutes left scheduled for this presentation. If people are willing to hang around longer, I'm more than happy to hang around and ask our questions, but let's continue to use that time to our fullest. And Linda, I don't mean to rush you in that regard, so please take your time, but you now have the floor.
Thank you so much. Again, Linda Foster, the Bloomington Normal NAACP president. This great organization was founded in 1909, right about 60 miles south of here in Springfield, Illinois. The NAACP is the nation's oldest, largest, and most widely recognized grassroots-based civil rights organization. From the ballot box to the classroom, the thousands of dedicated workers, organizers, leaders, and members who make up the NAACP continue to fight for social justice for all Americans. For all Americans. It's more than 500,000 members and supporters throughout the United States and the world. It's the premier advocate for the civil rights in their community, campaigning for equal opportunities, conducting voter mobilization. The local branch of the NAACP embarked on confronting the injustices of not having adequate housing, mental health, care, jobs for those that want to work, open restaurants without separate counters, education for all students, and equal opportunity. We've made great strides in the face of struggles and challenges put forth before us, empowered through the efforts of building relationships, sitting at the table, because if you're not at the table, you're on the menu, with those that make decisions and building a membership base that supports our efforts and our mission. We work to remove barriers of racial discrimination through a democratic process. It is our hope, and this is why we do the work, so that as each one of these speakers have shared the things that they do within their organization, that we continue this work, this civil rights work, this community work, because it takes all of us to be able to address the issues that are at hand. Now, I said the NAACP has been around since 1909. We've been in this community since 1918. We're here so that we can become a better community. We know that the effects of mental health on marginalized communities has a great negative impact when not addressed. We are part of the community. We are engaged with the community. We are in the schools, jobs, in your neighborhood, on the buses, and we are business owners. We know the history of racism and the impact that it's had on Black and brown people. Now, let me just kind of share with you about an experiment that happened with the Tuskegee Airmen coming back from being at war. It was called experiment because Black airmen were treated differently than those of their white counterparts. And they were coming back with diseases, and yet their white counterpart had the same type of disease. But there was this effort to try to figure out what were those effects. So they made them be guinea pigs. And so those individuals had to endure pain and loss of life. So when we talk about mental health in the Black and brown community, we talk about the traumas that they are enduring. We're talking about the reasons that one will have anxiety and addictions and substance abuse and suicidal thoughts. Mental health is real. And there are instances where it is piled upon Black and brown people. We need to make sure that we not only call it out like each one of these organizations, but we need to make sure that we're talking to the right people and that from that change can be made. The NAACP has fought and continue to be on this battlefield to fight the injustices of this world and of our community. Our aim is not simply to stop the diseases, but we also are here and speaking up and standing up so that we can combat the diseases that enters into our homes and family settings. But we also want to create an inclusion so that our culture is providing healthy people and healthy communities. Social justice, racial equality, inequality is about applying justice. And you know what? And a little bit of common sense.
Thank you very much. Sorry, Linda, I didn't mean to.
Okay, I'm sorry. I know we're running.
Sorry, I didn't mean to cut you off there. I just wanted to get in real quick because we only have about 10 minutes left, and I want to make sure our last two speakers here have a chance to talk real quick. But I do want to know, for those watching today, if you want to get involved with NAACP, how would we do that? What's the best way to get in contact or to become a part of NAACP or to be involved with the initiatives going on in the community?
Thank you so much for asking that question. To get involved, you can just look up our website, the Bloomington Normal NAACP. We meet monthly right now by Zoom. Again, check out our website, become a volunteer, look at what those areas of committees that we have, see where you fit in at. Everyone is welcome. Join in this work. Join in believing in our objectives and our mission so that we can become a more better and just community.
Thank you very much, Linda, and thanks for being with us today. Again, I'm sorry to our last speakers here. Have Gaynette Hoskins and Susan O'Neill from Prairie State Legal Services. Everyone here has been very impassioned today talking about their topics, so I know we haven't had a equitable time, which probably would have been fitting to put everybody like on a timer for this presentation. But with that being said, Prairie State Legal Services, you guys have the floor, and thanks again for being here today. Sorry, Susan or Gaynette, did we lose you, both of you? All right, well, so those are our representatives of Prairie State Legal Services that were having some technical difficulties earlier in the evening. So, oh, there we go.
Can you hear me now?
Yeah, now I can hear both of you. Okay. All right, so now you have the floor. How about that?
Okay, perfect. I was like, oh my gosh. Okay, great.
No, you got it. You guys
Well,
are good.
Susan, did you want to go ahead and introduce, or shall I? Okay, perfect. All right, so I am Gaynette Hoskins with Prairie State Legal.
And I'm Susan O'Neill. I'm the staff attorney at Prairie State Legal Services.
Okay, and I was able to get a hold of the questions, and I know that we don't have a lot of time, so I'm going to go ahead and just kind of breeze through. If I'm talking too quickly, you all, please slow me down, all right? Okay, so as I said, I am Gaynor Hoskins, the community advocate. What that role entails is basically saying that we know that there are a lot of barriers besides civil legal aid that many of our clients may endure. And what I try to do is make sure I can connect them with the people like Toy and like Miss Michelle and everyone else that's here on this call today. And I usually do that through like what Miss Michelle likes to call it, that warm handoff process. So a lot of the times I find a barrier with a client that's also may have an eviction or something else, and then I provide resources. I contact Toy or I contact Miss Michelle and I say, may we get some extra assistance. Besides that, what Susan is doing, since we are connected with this R3 program, I'm not sure if you all are familiar, that is Restore, Reinvest, and Renew. That program is geared towards helping people in communities, very oppressed, or communities, high-risk communities that have been over-policed or suffered major inhabitability issues or housing or eviction issues, and the government has decided that they were going to get some assistance out to them by way of us. So Susan is the attorney that will assist with their cases, with that's child welfare, divorce, sealing criminal records, any barrier that we can do on the civil aspect. That's what Susan usually deals with. And I deal with usually everything else. What we've been learning about a lot as far as like mental health trauma and how that impacts our roles is a lot of the times we catch people in crisis, and those people that are in crisis are unable to help us to actually provide services for them. So if Susan can't get all the information out from a person because they are in such a traumatized state or mental health is not in the right space, then they aren't able to get accurate representation in the courts. So what I've been doing is trying to make sure I can minimize those barriers, or try to, with all the training in the world, but still needing much, much more, try to assist them with being able to like de-escalate, knock out any barriers that we possibly can, and then go ahead and help have Susan do the civil legal aspect. The way that people can typically get by us is what we want to do is making sure that they can access us through all ways, so that's through email. They can call me. Heck, if they can put out a bat signal, they can reach out to me, and I would do what I possibly can. But I will also provide you all with that email information, the email and phone number for you to post a little bit later. I can't get this, so I'll get that to you all.
Yeah, no, I'll provide my contact information and then I'll get that from you. So don't worry about it.
Absolutely. And I think those were all the questions that they asked me to say, but I may be missing something. Did I miss anything?
Yeah, so I guess I'll turn it over to like Susan for now. Susan, do you have anything to add? Yeah.
Well, sure. I just wanted to say that even though I'm new to Prairie State in this program, I've represented people with disabilities for over 30 years. And I am also certified by NAMI to teach a number of their classes. And I have a son, an adult son who lives with bipolar disorder. And so I'm very familiar with clients with mental illness. And while Prairie State doesn't have a specific program for people with mental illness, we all know that a number of people that are living in poverty have some sort of a disability, and many people with disabilities are poor. So I used to work at Equip for Equality, and we only represented people with disabilities, and it's really the same people essentially at Prairie State or Equip for Equality. So the referral process Gaynette's telling you about, though, to call her directly is really key, because Gaynette and I have learned since we got here June 1st that the Prairie State phone tree system is a real big part, is a real barrier for people. They don't always get to see a lawyer. And by calling Gaynette, this program that we're working with is a lot more accessible and a lot more likely that they're actually going to get to talk to somebody. And there are no fees. And yeah, that's it.
Terrific. Okay. So you said there are no fees, and to contact GayNet correctly, can I also ask what are the other requirements in order to receive these services?
Well,
Okay,
it's complicated because we're all of us attorneys are at least are under different grants. Like we have one attorney who you have to be over 60 that for her program. We have two other attorneys, domestic violence. For GayNet and I, it's largely poverty, and just call us. We'll worry about that. It has to do with where you live. The state has divided up the Bloomington Normal into what they consider to be neighborhoods that have the most barriers to justice. So
Okay, so you would
just call
definitely
it.
want to get in contact then if you wanted to see if you did qualify, and that would be GayNet again, I'm assuming, in order to see if you met
Correct.
the qualification. Okay, terrific.
Correct.
Okay, and I'm sorry to cut you guys short today. I know, and GayNet, thank you for doing your speed presentation there. That was fantastic. I know Prairie State Legal Services does a ton of great stuff for this community, so I hate to cut them short. Please look them up online. And then also, if you need to reach out to GayNet, I'm going to be providing my contact information. At this time, I would like to open it up for any of our attendees that are still holding around there through the last hour and a half plus. If you have questions for any of our speakers, or additionally, if you're watching this on YouTube, once it is posted here within the next 24 hours, please use my contact information, which I will put into the sidebar right now. You can post your questions. Looks like we have one come in that's just a thank you for another good forum for Miss Sonia Reese, saying is very informative, and just a thank you to all of the speakers. I've also linked here the McLean County Behavioral Health YouTube page, which I alluded to. That will have not only the videos from this session and other sessions occurring last week and this year's forum, but last year's forum session as well, which includes over 20 different videos on a wide range of behavioral health topics. And then also the first link is our event page under the Behavioral Health Coordinating Council, so that you can register for any of our upcoming sessions. I want to thank everyone that was involved in today's presentation. At this point, I'm not seeing any other questions come up. So I will go ahead and keep that open. So if they do come up for individual speakers, I can reach out to you guys and get that information for those who hung around that are in attendance today. So once again, thank you all for coming. I hope everyone has a great day. I think this was a really great discussion. We had a great, an eclectic group of people. I really appreciate everyone's patience with technology, and I hope you all have a great day.
Thank you.
Thanks.
Thank you.
Thank you.